Today, I'm here to talk to you about Health Canada's authorization of Moderna's Spikevax COVID-19 vaccine for children 6 months to 5 years of age. This is the first COVID-19 vaccine authorized in Canada for this age group, which means that approximately 1.7 million children in Canada are now eligible to be vaccinated against COVID-19. Health Canada received Moderna's submission for children 6 months to 5 years of age on April 29th, and this submission built upon data from clinical trials in adults and older children, as well as the experience of administering hundreds of millions of doses worldwide. Health Canada authorized this vaccine as a 2-dose primary series administered 4 weeks apart. It's a smaller dose of 25 micrograms, which is half the dose authorized for children 6 to 11 years of age, and 1/4 of the dose authorized for people over the age of 12. The clinical trial showed that the immune response to Spikevax in children 6 months to 5 years of age was similar to that seen in people 18 to 25. And the clinical trials were conducted when Omicron was the predominant variant circulated in Canada and the United States. Efficacy estimates among participants 6 months to 5 years of age are similar to those in adults during the Omicron wave. As with all clinical trials, the children in the study were followed closely for any reports of side effects. And the vaccine was well tolerated, with no unexpected safety issues identified. The most frequently reported adverse reactions were irritability or crying, pain at the injection site, sleepiness, loss of appetite, and fatigue. The reactions were usually mild to moderate, resolving within a few days of vaccination, and no serious adverse reactions were reported.
A COVID-19 vaccine to protect young children has been long anticipated by many parents in Canada. Today's announcement provides parents and caregivers with a vaccine option to protect younger children in their care against COVID-19. The National Advisory Committee on Immunization, or NACI, has carefully reviewed the available evidence on the safety, efficacy, and immune response generated by the Moderna Spikevax COVID-19 vaccine, as well as the spread and severity of COVID-19 in children under the age of 5. NACI is recommending that a complete 2-dose primary series of the Moderna Spikevax COVID-19 vaccine may be offered to children aged 6 months to 5 years who do not have contraindications to the vaccine. NACI recommends at least 8 weeks between the first and second dose. For children 6 months to 5 years of age who are moderately or severely immunocompromised, NACI recommends that a primary series of 3 doses may be offered with an interval of 4 to 8 weeks between each dose. This is because people who are immunocompromised may have a lower immune response to COVID-19 vaccination. Infectious diseases like COVID-19 are unpredictable. Although younger children are less likely to get very ill from COVID-19, some can get really sick, including previously healthy children. Since Omicron became the dominant variant, more children have become infected, and the number of hospitalizations and ICU admissions of children under 5 years of age with COVID-19 has increased. COVID-19 vaccination in younger children will increase their protection against severe illness. Even if a child has been previously infected with COVID-19, vaccination is still important. While infection alone provides some protection, vaccination helps improve the immune response and can provide stronger and longer-lasting protection. For children under 5 years of age who have already had COVID-19, NACI suggests waiting 8 weeks after the start of COVID-19 symptoms or a positive COVID-19 test before beginning or continuing the primary series. Based on provincial and territorial projections, there will be sufficient supply of the Moderna Spikevax vaccine for children 6 months to 5 years of age. The Government of Canada is working closely with provincial and territorial partners and understands they will be rolling out vaccination programs for children in this age group shortly.
This is City News Everywhere.